This is a case of the exposed hardware, both the medial and the lateral malleolus in a adult. Plan for the non-skeletonized propeller flap for posterior tibial artery, and here the lateral malleolus defect. See the X-ray view, both the medial and the lateral malleolus hardware implant titanium plate has been given. After proper excisions of the defect, now we are planning for 90-degree non-skeletonized posterior tibial artery perforator based propeller flap. The flap has been harvested. Now the flap has been moved towards the defect site for the medial aspect. The proper coverage can be achieved with the help of this non-skeletonized posterior tibial artery based perforator propeller flap. The donor defect here covered with the split thickness skin graft harvested from the medial aspect of the right thigh. For the lateral defect, here we plan for a transposition flap, the donor defect covered with the split thickness skin graft harvested from the thigh. After complete OT, the split thickness skin graft has been placed on the medial aspect and the proper positioning of the flap has been achieved, and closed wound suction drain has been placed for the collection to be removed. On the lateral aspect, the proper split thickness skin graft given. After 1 week post-op first dressing, see the graft area. Some part of the graft has been lost from the periphery. The flap has been well settled after 2 weeks. The graft area. On the lateral aspect, some skin necrosis is there, but it became settled down later on. On the medial aspect, the tip necrosis of the flap is there, but we prefer to do nothing, wait and watch after removal of all the stitches. Here on the lateral aspect, small implant screw exposure is there, hypergranulation tissue at the edge or margin from the graft site, some hypergranulation tissue is there, and the superficial area of the flap has been necrosed, and small lateral aspect, one screw is exposed, but it will settle down later on. See the picture as a sequential manner. The medial non-skeletonized flap will settle down. Lateral transposition flap is also well settled down and the graft taken good. After 3 weeks, after 2 months, the well settled flap, no edema of the limb, and the donor site defect from where the graft has been harvested. After 3 months, see the full achievement of the movements. See both the elevation, plantar flexions, movement. See the well settled flap and graft, no exposure of any hardware on anything from both the left and the lateral and the medial aspect. Though initially we will do some debridement of this superficial part. Well settled, no edema is there. Very nice cosmesis is also achieved, no edema.